Gynecology, Gynecologic anatomy and physiology. The women's health movement. The women's health movement encourages women to be knowledgeable about their bodies, to appreciate the unique form and function of the female body, and to take responsibility for caring and making decision about their bodies, that will positively affect their health. The chapter reviews female anatomy physiology in terms of how they directly affect gynecologic health and well-being. Female anatomy and physiology are often referred to as reproductive anatomy physiology. Gynecology is defined as the branch of medicine dealing with the study of disease and treatment of the female reproductive system, regardless of whether a woman is pregnant or ever intends to reproduce. Her gynecologic care has historically focused on reproductive. This example of naming provides insight into why women often continue to be essentialized to reproductive function by clinicians. The authors of this chapter assume the reader has had basic human anatomy physiology content. Readers requiring a more in-depth discussion are referred to general anatomy and physiology reference. Pelvic anatomy, pelvic bones, pelvic joint. The pelvis is composed of 1-2 hip bones called the innominate bones, also known as coccyx. The sacrum and the coccyx. The innominate bones consist of pubis, ischium, and ilium, all of which are fused together at the acetabulum. The ilium comprises the posterior upper portion of the innominate bone, forming what is known as the iliac crest. It articulates with the sacroiliac joint posteriorly and together with its ligaments, is the major contributor to pelvic stability. The pubic bones articulate anteriorly with the symphysis pubis and with their inferior angles from the descending rami from the important bony landmark of the pubic arch. The ischial spine are bony prominences that are clinically important because they are used as landmarks when performing pudendal blocks and in other medical procedures such as sacrospinous ligament suspension, Ederson-Gendre. The ischial spines are also used to assess progression of fetal descent during childbirth. The sacrum and the coccyx shape the posterior portion of the pelvis. The sacrum is formed by the fusion of the 5 sacral vertebrae, which includes the important bony landmarks of the sacral promontory, the joints, the coccyx at the sacrococcygeal symphysis. The coccyx is formed by the fusion of 4 rudimentary vertebrae, is usually movable, and is itself a key bony landmark. The true pelvis constitutes the bony passageway through which the fetus must maneuver to be born vaginally. The best known classification of female pelvis is Caldwell-Molleu 1933 classification. Okay. Sacral promontory, ilium, sacrosciatic notch, coccyx, pubis, acetabulum. Sacral promontory, ilium, sacrum, sacrosciatic notch, coccyx, pubis, acetabulum, ischium, obturator foramen, symphysis pubis, ischial tuberosity, iliopectineal eminence, ischial spine, sacroaxial symphysis, linear terminalis, sacroiliac synchondrosis. Which includes 4 basic pelvic types: gynecoid, android, anthropoid, platypeloid. Each pelvic type is classified in accordance with the characteristic of the posterior segment of the inlet. The development of this classification resulted in the realization that most pelvis are not pure types but rather a mixture of types, Kolisova and Vetra. Pelvic supports structures include not only the muscles and connective tissue of the pelvic floor, but also fibromuscular tissue of the vaginal wall and endopelvic connective tissue. Richter and Werner 2007. The piriforms and obturator internus muscles their fasciae form part of the wall of the pelvic cavity. The piriforms muscle originate at the front of the sacrum near the third and fourth sacral foramina. The muscle leaves the pelvis by passing laterally through the greater sciatic foramen and insert in the upper border of the greater trochanter of the femur. The origin of the obturator internus muscle includes the pelvic surface of the ilium and ischium and the obturator membrane. It exits the pelvis through the lesser sciatic foramen, where it attaches to the greater trochanter of the hip, and enabling it to function in external hip rotation. Anderson, January 2007, Corton 2000. The deep perineal space in a pouch that lies superiorly to the perineal membrane. This deep space is continuous with the pelvic cavity, contains the compressor urethrae and uretherovaginal sphincter muscle, the external urethral sphincter and parts of the urethra and vagina, branches of the pudendal artery and the dorsal nerve and vein of the clitoris. The perineal membrane is also known as the urogenital diaphragm. Although this level is a misnomer, is a sheet made up of dense Caldwell-Molloy classification of pelvis: anthropoid, gynecoid, platyploid, android. Anthropoid, android, gynecoid, platyploid, fibrous tissue that spans the opening of the anterior pelvic outlet, the perineal membrane, attached to the side wall of the vagina and provides support to the distal vagina and urethra by attaching this structure to the bony pelvis. Corton 2012. The levator animuscle is a critical component of pelvic support. Indeed, it is often considered the most important muscle of the pelvic floor. Corton 2012. Normally, this muscle is in a constant state of contraction, providing support for all of the abdominopelvic content against intra-abdominal pressure. The levator ani muscle is actually a complex unit of several muscles with different origins, insertion, and function. The coccygeus, puborectalis, and iliococcygeus are the primary components making up this muscle. The pubococcygeus is further divided into pubovaginalis, puboperinealis, and puboanalis. The levator ani and coccygenous muscle. The levator ani coccygeus muscle form the pelvic floor. The related fascia form a supportive sling for the pelvic contents. The muscle fiber insert at various points in the bony pelvis form functional sphincter for the vagina, rectum, urethra. The origin of the levator ani muscle is the pubic bone and the adjacent fascia of the obturator internus muscle. Various portions of the muscular sheet insert on the coccyx, the anococcygeal rapine, and the perineal body, which is a fibrous band lying between the vagina and the rectum. The different sections of the levator any muscular sheet are subdivided based on the exact origin and insertion of the fiber. खुदा कितने पेज है? 5, 6, 7, 18. Oh, great. Oh no. Superficial musculature of the perineum, clitoris, urethra, perineal vestibule, vagina, bulbocavernosus muscle, equicavernous muscle, equipubic ramus, vestibular bulb, Bartholin's gland, ischial tuberosity, superficial transverse perineal muscle, sphincter membranous urethra, perineal membrane, deep transverse perineal muscle, superior fascia urogenital diaphragm, levator ani pubococcygeus muscle, central tendinous point perineum, levator ani iliococcygeus muscle, gluteus maximus muscle, external anal sphincter, fat coccyx, anococcygeal body, rectum, superficial transverse perineum, ischial tuberosity, Bartholin's gland. Okay. The levator prostatae or sphincter vaginae fibers from the sling around the vagina and originate from the posterior surface of the pubis. They insert in the perineal body. The puborectalis fiber are important in maintaining fecal continence. They originate from the posterior surface of the pubis and form a sling around the rectum. The pubococcygeus fiber originates from the posterior surface of the pubis and insert into the anococcygeal rapine. The iliococcygeus fiber originates from the obturator internus fascia and the ischium and insert into the anococcygeal rapine. The fan-shaped coccygeus muscle lies anterior to the sacrospinous ligament, originates from the ischial spine, insert into the lower part of the sacrum and coccyx and work synergistically to aid the levator ani muscle. The transverse perineae are small strap-like muscles that help support the pelvic viscera. They originate from the ischial tuberosity, pass by the genitalia and insert in the central tendon at the midline. The bulbocavernosus muscle aid in strengthening the pelvic diaphragm and in constricting the urinary and vaginal openings. Their muscle fibers originate in the perineal body and surround the vaginal openings as the muscle fiber pass forward to insert to the pubis, and the ischiocavernous muscle contracts to cause erection of the clitoris during sexual arousal. Its muscles fiber originate in the tuberosities of the ischium and continue at an angle to insert next to the bulbocavernosus muscle. Anderson, January 2007, Cotton 2012. Female genitalia. Dr. Nelson. Soka Socks. Dr. Nelson Soka Socks, a Brazilian gynecologist, has devoted much of her writing to the traditionally typical and symbolic aspects of women's sexual organs and the importance these views have in influencing our understanding of woman's nature. According to Soka Socks, 1993A, 1993B. Historically, it was believed that the key is understanding the female psyche was having a deeper understanding of woman's genital function. By tradition, a woman's uterus was considered the fundamental organ, was synonymous with her genital organ. This conception depicted a woman's wholeness to be totally related to her genitals, of which the most important was her uterus. Consequently, there was little appreciation for female genitalia. This section describes the multiple organs and anatomic structure that constitute a woman's gynecologic anatomy, which are shown in a mid-sagittal view in Figure 5.4, color plate 1. Equally important to the discussion of women's gynecologic anatomy are the multiple non-genital peripheral anatomic structures involved in female sexual responses, such as salivary, sweat glands, cutaneous blood vessel, and breasts. The vulva is the externally visible outer genitalia. It includes the mons, pubis, labia majora, labia minora, labia, clitoris, urinary meatus, vaginal opening, and corpus. Mid-sagittal view of a woman's pelvic organ: cervix, rectum, vagina, fallopian tube, ovary, uterus, urinary bladder, pubic bone, urethra, clitoris, labia minora, labia majora, sagittal section. Female external genitalia: suspensory ligament, labia minora, labia majora, clitoris, mons pubis, clitoris, urethral opening, vaginal opening, perineum, anus. फिर क्या है ये 6 ओके स्पॉन्जिनोसम ओके Sponginosum erectile tissue vestibular bulbs of the labia minora and perineum. The vestibule is inside the labia minora and outside the hymen. On each side of the vestibule is a Bartholin's gland which secretes lubricating mucus into the introitus during sexual excitement. The mons pubis is the mound-like fatty tissue that protects symphysis pubis during puberty. Genital hair growth covers this pad of tissue. The labia majora are fused anteriorly with the mons veneris, anterior prominence of the symphysis pubis, posteriorly with the perineal body of the posterior commissure. They exist in keeping the vaginal introitus closed, in which in turn helps prevent infection. The labia minora are surrounded by the labia majora and are smaller non-fatty folds covered by non-hair bearing skin laterally by the vaginal mucosa on the middle aspect. The anterior aspect of the labia minor forms the prepuce of the clitoris and also assists in closing the opening of the urethra and the vagina. Women's vulva vary in size related to the amount of adipose tissue, length, pigment, color of the labia minora and or majora, which may be light pink, dark pink, shades of gray, peach, brown, black. There is also considerable variation in the size of labia minora in women of reproductive age. The labia minora are usually more prominent in children and women who are postmenopausal. Clitoris. The clitoris is a sensitive organ that is typically described as a female homologue. Particularly in the terms of its erogenous function. During the early 1800s, as a respected English gynecologist, I. Shark Blacker Brown theorized that habitual clitoral stimulation was the cause of the majority of women's disease because it caused an overexcitement of women's nervous system. As a result, clitorectomy came into the favor as a means to rid women of ailments believed to be caused by clitoral stimulation. Fortunately, this theory has long been refuted. The practice of clitorectomy in the Western world is rare. Anatomically, the clitoris is formed from the genital tubercle. Bradshaw, 2012, Martini, Timmons, and Tallis, 2011. It is 1.5 to 2 centimeter in length, consists of two corpora cavernosa, and is covered by a sensitive round tubercle known as the glans. Anderson and Gendry, 2007. Records 2012. ये क्या है 7. The clitoris is a small sensitive organ that consists of two paired erectile chambers and is located at the superior portion of the vestibule. These chambers are composed of endothelial lined lacunar spaces, tubercular smooth muscle, and tubercular connective tissue. They are surrounded by a fibrous sheath, the tunica albuginea, the paired corpus spongiosum, bilateral vestibular bulbs, unite ventrally to the urethral orifice to form a thin strand of spinogiosous erectile tissue connection. Pars intermedia that ends in the clitoris as the glans. Martini et al. 2011. Clitoris is kept externally by the glans, which is covered by a clitoral hood formed in part by the fusion of the upper part of the two labia minora. The clitoris has numerous nerve endings and contain tissue that fills with blood when the woman the blood supply to this organ includes the dorsal and clitoral cavernosal arteries, which arise from the ilio-hypogastric pudendal bed. The autonomic efferent motor innervation occurs via the cavernosal nerve of the clitoris arising from the pelvic hypogastric plexus. Bradshaw, 2012, Cats, 2012. The labia majora, together with the clitoris, play a critical role in sexual cavity activity because of their rich nerve-vascular supply. They are easily sensitized and become engorged with blood during. Okay. This vascular erectile tissue is capable of becoming significantly enlarged and tense during. In addition to the great quantity of erectile tissue in the clitoris, erectile tissue is found inside the labia majora minora, around the vulvovaginal opening and along the lower third of the vagina. A very small quantity of this tissue can also be found in the vaginal walls and along the urethra. Female sexual dysfunction from decreased clitoral sensitivity may be associated with histologic changes in clitoral cavernosal erectile tissue. Periurethral glands. Two skinny periurethral glands open directly into the vulva are adjacent to the distal urethra. The skin glands, which release mucus, form a triangular area of mucous membrane surrounding the urethral meatus. From the clitoral glands to the vaginal upper rim and caruncle. Bartholin's and greater vestibular glands. The pea-sized Bartholin's glands are located at about the 4 and 8 o'clock position in the vaginal area just beneath the fascia. Each gland has an approximately 2 centimeter duct that opens into a groove between the labia minora and hymen. The glands, which are made of columnar cells that secrete clear whitish mucus, are stimulated during and the Bartholin's ducts are blocked. Infection can occur, resulting in cyst formation that can lead to the development of an abscess requiring surgical incision and drainage. Internal genital anatomy. Urethra. Ovaries. Okay, urethra is a short conduit approximately 3 to 5 centimeter long, extending from the base of the bladder and existing externally to the vestibule. The urethral mucosa is composed of stratified transitional epithelium near the urinary bladder. The rest of this structure is lined by a stratified squamous epithelium. Guards. 2012, Martini et al. 2011. In women, the urethra passes through the urogenital diaphragm, which is a circular band of skeletal muscle that forms the sphincter urethrator, known as the external urethral sphincter. Martini, for a woman to urinate, the sphincter must be voluntarily relaxed. It's a typical state in contraction. Ovaries. The paired ovaries resemble a large almond in terms of their size and configuration. They are located near the lateral wall of the pelvic cavity. Curts. 2012, Martini at 2011. Each ovary measure approximately 1.5 centimeter, 2.5 centimeter, 4 centimeter, and weighs 3 to 6 gram. The ovaries produce gametes, also known as ova, the sex hormone known as estrogen and progesterone. The color and texture of these organs change with a woman's age, reproductive stage. The ovaries in a nulliparous parous women are situated on a shallow depression called the ovarian fossa, located on either side of the uterus. In the uterus, in the upper pelvic cavity, several ligaments support the ovaries. The broad ligament in the principal supporting membrane of the woman's internal genital organ, including the fallopian tubes and uterus. The remaining ligaments include mesovarium, a posterior extension of the broad ligament, the ovarian ligament, which is anchored to the uterus, a suspensory ligament, which is attached to the pelvic wall. Outermost layer of the ovary is composed of a thin layer and cuboidal epithelial cell called germinal epithelium. Immediately below this epithelial layer is the tunica albuginea, which is made up of collagenous tissue. The ovaries comprise three parts: an outer cortical region, cortex, which contain germinal epithelium with oogonia and ovarian follicle that number approximately 4 lakh. At the initiation of puberty, Hall version 2012, a medullary region, medulla, which is consists of connective tissue, myoid-like contractile cells, and interstitial cells, a hilum, which is the point of entrance of Allah. Point of entrance for helium, which is the point of entrance for all of the ovarian vessels and nerves. Hall version 2012 B cards to ovarian. The ovarian arteries that arise from the aorta descend in the retroperitoneal space and cross in front of the psoas muscle, internal iliac vessels. They enter the infundibulopelvic ligament, finally reaching the mesovarium found in the broad ligament. The ovarian blood supply enters through the hilum, and venous return occurs through a venous plexus, which collect blood from the adnexal region and drains into the vena cava on the right and the renal vein on the left. Innervation of the ovaries is accomplished by parasympathetic fiber of the ovarian plexus that descended along the ovarian vessel. This nerve supply the ovaries and broad ligaments and uterine tube. Parasympathetic fibers in the ovarian plexus arise from the vagus nerves, and nerve fiber to the ovaries innervate only the vascular network and not the stroma. Cards to 2012. Because the ovaries surrounding peritoneum sensitive to pain and pressure, it is important to take great care when examining the ovaries during the bimanual examination.